Welcome to today's episode of Navigating Nursing School with your nursing tutor. Today is a dosage calculations episode, but do not be scared. Do not be nervous. I'm going to help you out. I'm going to make this easier for you just like I do with everything else, okay? Today we're going to talk about, I'm going to teach you one simple concept that's going to help it make it easier for you to know what to plug into your dosage calculations when you are solving problems for nursing school. And I'm also going to talk to you about exactly what you need to memorize if you want to hope to become better at dosage calculations. And I'll give you my 3 best tips for how to easily memorize that information. And here's a spoiler alert. It's not formulas. It's not formulas. I'm not a big fan of formulas. So maybe we'll talk about that too. But if you don't know me already, my name is Nicole. I am the founder of Your Nursing Tutor, and I've been a professional nursing tutor for over 15 years, helping nursing students and pre-nursing students just like you get through nursing school confidently and calmly. And if you would like some free information about how I do that using the Silver Bullet study system, you can always go to my website at yournursingtutor.com/SBSS and get a free 10-minute video that tells you all about the 4 steps of the Silver Bullet study system and includes a free download to help remind you what those 4 steps are so that you can study better for nursing school. Today, though, we're talking about dosage calculations, and I'm going to have a free treat, award, like prize, I don't know, a freebie for you with dosage calculations too that I'll mention in a little bit. But let's talk about what simple concept you need to know about dosage calculations in order to make it useful. Okay. What you need to know is what I call the buddy system. The buddy system. And the way I explain the buddy system might seem a little bit silly. It might make you a little nervous because I have a question to ask you. And I want you to play along. Okay. So play along. Answer the question wherever you're at. And I'm going to tell you in advance, it is not a trick question. Not a trick question, so don't overthink it. Everybody always overthinks it. If I wrote a fraction on the board, okay, so imagine I'm writing a fraction. If I'm writing a fraction, I put a 2 on the top of the fraction. I put a 2 on the bottom of the fraction. What is that number equal to? 2 over 2. What is that number equal to? If you said it is equal to 1, you are correct. Good job. See, not a trick question, okay? As a professional nursing tutor, I never ask you trick questions, just FYI, because I don't want you to feel like you're on the spot. If I ever ask a trick question, I'll warn you in advance that it's a trick question so that you know. This is not a trick question. Now, I have a follow-up question that is also not a trick question. Here's the follow-up question. So we have our original fraction of 2 over 2 that is equal to 1. But now what we're going to do is we're going to flip-flop that fraction. Okay, flip-flop it. We're going to take the 2 that was on the top, and we're going to slide it on down to the bottom. And then we're going to take the 2 that was on the bottom, and we're going to slide it on up to the top. Okay, so now our new fraction is 2 over 2, but the 2's have been flipped compared to the first one. What is this fraction equal to? Now, hopefully, you quickly answered, it's still equal to 1, Nicole. It's still 2 over 2. And you would be, of course, absolutely correct. Why is this important for dosage calculations? It's because whenever you divide something by itself, it's equal to 1. Like, that's kind of a basic math concept that, let's be honest, you've probably forgotten about since elementary school. It's okay. I'm here to remind you of what you need to know. It's fine. But when we are doing dosage calculations, we almost always are working with buddies, because remember, I like to call my fractions buddies. We almost always work with buddies, but they don't look like they're buddies because they're wearing Halloween costumes. And I'm going to explain to you what I mean. When we have conversion factors, okay, so this is going to be your, there's 1,000 milliliters in a liter. There's 2.2 pounds in a kilogram. There's 5 milliliters in a teaspoon, okay? All your conversion factors, they are the same. They are equivalent to each other, okay? That makes them buddies. So let's look at this. How do you test to see if something is a buddy? You ask the buddy question. So let's look at, for every liter, you have 1,000 milliliters. So 1 liter equals 1,000 milliliters. So this is the buddy question. I kind of accidentally just asked it for you. Did you catch that? You say, if I have 1,000 milliliters of liquid, do I have 1 liter of liquid? And of course the answer would be yes. And you say, if I have 1 liter of liquid, do I have 1,000 milliliters of liquid? And the answer is always yes. So the buddy question, the buddy system question should be able to be asked in reverse. Because if you have one of something wearing the conversation of milliliters, you should also have the same amount of that something, even if they're wearing the Halloween costume of liters. Okay. Same thing with, 2.2 pounds and a kilogram. If I have 2.2 pounds of something, do I have 1 kilogram of something? And of course the answer is yes, because it's a conversion factor. And if I have 1 kilogram of something, do I have 2.2 pounds of something? And the answer is yes, because it's a conversion factor. It's the same. It's the same, but they don't look the same. So when you are thinking about the buddy system and using this concept to make dosage calculations easier, the important thing to remember is that the numbers don't really matter. Okay? Like the numbers, they don't matter yet, I should say. They matter at the end of the when you're setting up your problem. But when you're setting up your problem, the numbers don't matter. They're just along for the ride. The things that matter are those Halloween costumes, because when you set up your problem, in order to know if you've correctly set up your dosage calculation problem, the goal is to find the Halloween costume that you're solving for. So let's see, if you're doing an IV flow problem, it would probably be like milliliters per hour. So you need to look for Halloween costumes that are going to get you to milliliters per hour. And those are the numbers you care about. But all the other numbers that you need to include, you got to get them naked. Okay. So this is a dirty episode. We're talking about getting numbers naked. And so that we can see what they really are. We can get them dressed in the solution. And I have a whole method for how to do this. I told you I hate the formula method. Let's be honest. Hate is not too strong a word. I don't like, I hate the formula method. Some students like it. That's okay. If it's working for you, I always say, don't fix what ain't broke. But I usually find that, the students come to me because you need help. And if you need help, that means the formula method is probably not working for you. And that means you should try something new. And I teach dimensional analysis, but I teach it in a way that is different than you've ever been taught it before, because it's very specific to dosage calculations. I have some strict rules. And if you just follow those rules, you'll literally never get a question wrong again. I can successfully teach this to you in an hour. Right? So sometimes students will sign up for a one-on-one tutoring session with me, which are 90-minute sessions. And I teach it to them in an hour, and we have extra time to do examples, right? And then, but if you don't want to do a one-on-one tutoring session, if you want more ongoing support, it's the dosage calculations training is included in my group tutoring membership, which is a monthly membership that you can join and cancel at any time. And it also comes with live support. So I love the group tutoring membership option better than the one-on-one tutoring, unless you want to combine them. But the group tutoring is nice because then you can watch the training, which is me teaching you how to do the system. You can try it for yourself. And if you get stuck, I would say in my group tutoring membership, anytime you get stuck, you just take a picture of your work that you got stuck on, post it in our members only forum, and then I can look at that and I can tell exactly what confusion you're still having. So I can correct any mistakes you're making. And not only that, but I can tell you what you need to do differently in the future so you don't have those confusions or mistakes anymore. And so that's what I do in the group tutoring membership. So you basically get support like all throughout the month, whereas a group tutoring session, you only get me during that 90 minutes. So yeah, and you can get information about my group tutoring membership if you go to yournursingtutor.com/membership. Okay. So the buddy system. So once we have the buddy system, the other thing about the buddy system that's important is because when we're plugging buddies into dosage calculations, whether it's a formula or my method with dimensional analysis, remember, they are the same. Even though they are wearing Halloween costumes, so they look different, they are actually the same. And we check that with the buddy system question. That means we can flip-flop them. So when we plug them into the problem, we can put them right side up or we can put them upside down, depending on what we need in order to correctly solve that problem. Now, in the formula method, that's one way of trying to figure out how to plug things in. But for my method, you just follow the rules. So like there's 2 rules, like I mentioned, and you know, I don't have time to go over the whole, like I can't teach the whole method in a 20-minute podcast. Okay. But the rules will tell you, they will show you, so you always know, do I plug this buddy in right side up, or do I have to flip it and plug it in upside down? And that'll be able to guide you through. I always say, like, you put your Sherlock Holmes cap on and you follow the clues. That's what the rules do for you. They tell you what the clues are so you know how to follow them. And yeah, so that's the buddy system. That's the Halloween costumes and how it helps you to understand how to set up the problem. Now, here's the information you have to memorize in order to really hope to do well in dosage calculations. Now, with my silver bullet study system, when you're studying other topics in nursing school, there's step 1 always starts with the foundational 15. Like you have to have your baseline of foundational knowledge to build on, to have a solid structure, like to be able to feel confident in in your nursing care and things like that. And dosage calculations is no different, really. And so the kind of the foundational information you have to know, because it's usually memorized stuff. The foundational information you have to know for dosage calculations is your conversion factors. Okay, so that's probably not a huge surprise to you. But I do have some tips for how to memorize your conversion factors easier. And I also have a free download for you that, like I said, I mentioned, I have a free gift for you. If you go to yournursingtutor.com/DC, that's DC, like dosage calculations. So yournursingtutor.com/DC. And just put in your email and I will send you a free copy of my practice plan that I recommend to all of my private tutoring members who need to get better at dosage calculations. And that also includes on the download all of the conversion factors that I recommend memorizing. And they're also organized in the way using the tips I'm about to tell you. Okay, so yournursingtutor.com/DC to get that free download with the conversion factor chart organized that's in a way that's going to make it easier for you to memorize. So here's my 3 tips. My first tip has to do with the organization, since I just kind of let that cat out of the bag. It's in the freebie too. It's grouping your numbers. It's grouping things. So don't just memorize things, one-to-one. Right? Don't only memorize things like I've been saying, like 1,000 milliliters is equal to a liter. That's good. For some of them, you want to do that. But there's other things that you can actually group in trios. And here's what makes this a dirty episode too. We were talking about numbers getting naked because we want to take off their Halloween costumes and get them into the right outfit. Now we're talking about threesomes. Okay. So instead of just doing 1-to-1, sometimes you can combine your memory work by grouping things into 3s. And that's going to be, especially when you're combining like with the apothecary system. So like the teaspoons and tablespoons and ounces, look for ways that you can put things together that make sense to your brain. So for example, you can do kind of a stair step. So if 1 ounce is equal to 30 milliliters, or let's keep it in the apothecary. If 1 ounce is equal, well, you know what? Let's do it that way. 1 ounce is 30 milliliters. 2 tablespoons, or 1 ounce is also equal to 2 tablespoons. And 1 tablespoon is equal to 3 teaspoons. So probably the way I would do that is, let's leave out the milliliters. I take that back yet again. So we would say 30 ounces is equal to 2 tablespoons. And then 2 tablespoons would be equal to 6 teaspoons, right? So we could be like, so then you always have a way of connecting the 3 of those. So if you ever need to do a conversion between any of those 3 things, you just have to pick the correct numbers out of there and the correct Halloween costumes, and you can create your own buddy. So and this is easier because now you only have 1 conversion factor set to memorize instead of 3. It would be 3 separate ones otherwise, because you would have to memorize 1 ounce is 2 tablespoons. You'd have to memorize that probably 1 tablespoon is equal to 3 teaspoons, and you'd have to memorize potentially that 6 teaspoons is equal to 1 ounce. That's 3 things, and it can be kind of confusing. But again, if you just stair step it, then 1 ounce is equal to 2 tablespoons is equal to 6 teaspoons. Easy peasy, right? That's a lot simpler to remember and a lot less complicated, but you can always do the mental gymnastics later to figure out what you need to know on the fly if you need to use one of those. So that's one of my tips, is to group things in trios and organize them in a way that reduces the total amount of memorization you need to do. The second tip that I have has to do with how you memorize your metric system. How you memorize your metric system. So obviously in America, we don't use the metric system a whole lot until you get to nursing school, right? So you might not be totally familiar with it. I'm sure you've heard of it. You've used it a little bit, probably in your science prerequisite classes and things like that over the years. But on everyday level, we don't use the metric system a lot here. But you do have to know it in nursing school, obviously. I find that a lot of times in science classes, or if you look up a metric system chart, they usually put things in decimals, and decimals make my brain hurt. So here is my tip. Learn the metric conversions in whole numbers. Learn it in whole numbers. You can totally do that. There's no rule book that says you have to do all your metric conversions in decimals. No, nobody is saying that, okay? If you look up a metric, like an official metric table chart, usually they set it up with decimals because they'll take whatever the base unit is, the base unit, like grams, and they will they'll make that 0. And then if it's a metric unit that is bigger than that or one that's smaller than that, then one side will be whole numbers, one side will be decimals. Why? Like, let's just work with whole numbers on both sides of the chart. And the way we can do that is on a metric table, you would see something like, so let's just stick with milliliters to liters example. You would see something like 1 milliliter is equal to 1,000th of a liter. So 1 milliliter is equal to 0.001 liter. Again, makes my brain hurt. I don't like working with decimals if I don't have to. We can flip that around and say, if we have 1,000 milliliters, so we're just multiplying both sides by 1,000. If we have 1,000 milliliters, we have 1 liter. That is exactly the same. And you can check yourself with the buddy system too, because the buddy system question with this is another useful way of the buddy system to check yourself. Because we could say, if I have 1 milliliter, do I have 1,000th of a liter? And the answer is yes, you do. And if you have 1,000th of a liter, do I have 1 milliliter? Yes, you do. Well, if I have 1,000 milliliters, do I have 1 liter? Yes, you still do. If I have 1 liter, do I have 1,000 milliliters? Yes, you still do. So both of those buddies are equal to 1, okay? Conceptually, obviously not like just the numbers wise, but conceptually, if you take their Halloween costumes into account, they are equivalent. And therefore, they're the same. So when we plug things in and we need a conversion factor in our dosage calculations problem, we can use either version of the conversion number and still get the correct answer. Okay, and I know if math is not your strong suit, you might be like staring at me side-eyed right now, but you don't have to understand all the underlying math principles. That's what I do for you. Okay, that's what I did for you when I developed my dosage calculation method, is that I understand all of the underlying math principles so that you don't have to. But then I used those math principles to come up with a systematic way to come up with easy to follow rules that you can then follow. And as long as you follow those rules in that method, then you will be taking advantage of all those math principles, even if you don't understand them. Okay? Isn't that nice? So anyway, that's one of the things you can do, is memorize your metric system using whole numbers instead of decimals. And then if you're like me, and decimals make your brain hurt, we're good to go. Now, here's my third memorization tip for memorizing your conversion factors, and that is use flashcards. Again, I don't like flashcards a lot of the time, and you will see me make TikTok videos saying, don't use flashcards. And of course, part of that is just kind of like the get more views on TikTok, right? Because flashcards aren't always bad. They're often bad, but they're not always bad. And the biggest difference is it has to meet my 1-to-1 rule in order to be able to use flashcards. And so this is my flashcard rule that I always make my tutoring students follow. If the information you want to use on a flashcard is a 1-to-1 correspondence of information, then we can use it on a flashcard. And this definitely meets that criteria because we have one number with a Halloween costume and another number with a Halloween costume. 1-to-1 correlation. We can memorize that with a flashcard if we want to. Now, when we're using flashcards, it is best to use them like multiple times per day in small bursts. Doesn't matter if you use paper flashcards or like digital flashcards like Quizlet or something. Doesn't matter, but it's the frequency over time that helps with memorization better. And anything you can do to make it an active learning strategy will help as well. So, for example, if you look at the flashcard and you actively try to remember what's on the other side of the flashcard, you are going to memorize it faster than if you just look at the flashcard, flip it over, look at the next flashcard, flip it over, but you're not actively trying to remember or guess what's on the next flashcard. You're just reviewing them versus trying to actively generate the answer for yourself. So that's actually kind of a bonus tip, active learning strategies. So those are my 3 tips for how to memorize the conversion factors and combine that with the buddy system, and you have a really solid foundation for doing better with dosage calculations, especially if you decide to learn my method and follow those rules and get really confident with it. So again, remember, I have one more thing I want to tell you. But first, remember that you can get my free practice plan where I tell you exactly, this is like the exact practice plan I give all my private tutoring members that I work with when they need help with dosage calculations. You can get that for free with the conversion factor chart at yournursingtutor.com/DC, dosage calculations, DC. Or again, you can learn my entire method for confidently solving dosage calculations without needing formulas by joining my group tutoring membership. Now, one more thing. I want to give a special shout out to Abby. I always ask y'all to give me reviews. If this podcast has been helpful to you at all, head on over to Apple Podcast Reviews. This is how a lot of other nursing students and pre-nursing students find out about the information that we share to try to make nursing school easier for y'all. And so if this has been helpful to you, please give me a 5-star review on Apple Podcasts. And I wanted to give a shout out to Abby, who left me a review in February. She said, "Love it. I'm so glad you're releasing new episodes." I am too, Abby. It's been too long since I started. I'm glad I reactivated my podcast. But she says, "I'm still in my pre-nursing studies, but I still feel like I'm getting something from this, even if it's just various facts and study tips." Yes, I am so glad that you found the podcast, Abby. I'm so glad you're finding value from it. Know that everything that you're learning now, it's setting up your mindset. It's changing the way you think about studying for nursing school. Everything's going to combine and contribute to make your nursing school start easier. Because of one thing, like just knowing the expectations, a lot of times people go into nursing school having one expectation and then get there and their expectation is not met. And this is why there's so many nursing school horror stories. But if you go in knowing you have to be an independent self-learner and knowing the tools, or at least where to go to get the tools that you need in order to accomplish that, then your nursing school experience can be set up to be a lot more positive than some other students have experienced. So I'm so wonderful, so wonderful to hear. So glad you found me. And if anybody else has stories like that, I would love to hear them. Just head on over to Apple Podcasts, give a 5-star rating. And if you have any words or to tell me about, I would love to hear them. And maybe you'll be featured on a future podcast as well. So until next time, good luck on your nursing school journey.